Child physical abuse. And my name is Diana Parra. Child abuse is defined as doing or failing to do something that results in harm or risk of harm to a child. There are four types of abuse: physical, sexual, emotional, and neglect. While child physical abuse might be most visible, other types of abuse leave deep and lasting emotional scars. Early intervention is key to help abused children heal. Physical abuse is defined as injuries that result in substantial harm to a child or the genuine threat to substantial harm. For physical injuries to a child, this could include any injuries that differs from explanation given, excluding an accident or a reasonable discipline by a parent or guardian that does not expose the child to a substantial risk of harm. Physical abuse also includes the failure to make a reasonable effort to prevent an action by another person that results in substantial harm for the child. For example, when they are neglecting the child or when they are letting the child get hurt or when they are hurting the child on purpose. Physical abuse exhibit impaired capacity to enjoy life. They tend to be unhappy, like they don't like to be happy. They think that if they're happy, they're gonna get hurt. Um, psychiatric symptoms, tantrums, hyperactivity. They tend to do tantrums when they think they're gonna get hurt or when they wanna call for attention. They tend to have learning problems at school. They also have low self-esteem. They think like they don't worth anything. Like they are just there to suffer. They're they think that nobody's gonna care for them. Um, they also have compulsivity. Um, some of the signs of physical abuse are hitting, punching, kicking, shoving, choking, or slapping. Like in the picture, it shows that somebody slapped the little girl on the face and she has a mark of the full hand on her cheek. And like I told you before, it's a sign of abuse. It could also be controlling when you eat or when you sleep. By saying that, it's like not letting people or not letting the child or the person eat what they want or when they have to eat, when they're hungry, or not letting the child go to sleep on time, or when they want to go to sleep, forcing forcing the child or the person doing work against their will, like making them do hard work outside when it's sunny, super sunny, and there's 100 degrees. They're not letting the child uh, drink water, or when they're making the child clean the toilet with a toothbrush, um, or with a lot of bleach, that a lot of chemicals can hurt you too. Um, Also, forcing you to use drugs or alcohol, well, that's very dangerous for the children, but it could happen. Forcing the child to drink alcohol, or stopping you from seeking medical treatment or calling the police. That's also physical abuse, when they don't let you go to a hospital, or when they don't let you call for help. Physical effects of physical abuse. The short-term effects of physical abuse are typically obvious, like I mentioned before, and are treated by an emergency room physician or other healthcare providers. They can range from cuts, bruises, broken bones, and other physical maltreatments. There are long-term physical abuse terms from these injuries as well. However, it can also result in a number of biological consequences, such as death, brain damage, mental retardation, learning disabilities, and sensory deficit. Brain damage, when they are hitting the person or the child multiple times in the concrete, against the wall, or even with just their hand. Or it can result in death when they hit them like a lot. Mental retardation, it can cause mental retardation on them because of all of the brain damage. It could also, by the brain damage, it could affect the learning process of them, not letting them be able to walk, or to move their hands, or to forget who they are. Unfortunately, many of the injuries sustained from physical abuse affect the victim as they grow older. The long-term effects of physical abuse includes arthritis, high blood pressure, heart disease, sexually transmitted disease in case there were sexual abuse, chronic pain syndrome. High blood pressure, I believe it's because of the anxiety that it causes. Heart disease is because of the high blood pressure. Chronic pain syndromes, it's because of the all of the maltreatment that they have been going through, or because the body is tired of all of the maltreatment. Children who are affected by physical abuse, not exactly that they have been abused, but they have seen people being abused, even though that the children are not directly being abused. If they see what is going on, they tend to stutter, They tend to have anxiety attacks, fear attacks, compulsive behavior, or sleep disruption. Because they think a lot of what's going on at their home, what maybe the dad is doing to the mom, or a real a related relative is doing to mom or dad. So they tend to think a lot of it, and it could affect them in the sleeping pattern. Then anxiety attacks, it could be because they are what they're going through, what they're watching, and fear because they don't want to see it anymore, because the kids are scared of that person, or are scared that something's gonna happen to mom, or are scared that something's gonna happen to brother or sister. And compulsive behavior because they they don't think what they're gonna do. They just do it because of all of the things that they're seeing at home, what they're watching, what they're going through. Excessive crying because they don't know how to work their feelings out, because nobody has shown them how to process their feelings. Problems at school. They have problems at school because maybe they're trying to do the same thing as um, what they have seen at home. Depression. They are depressed because of what they have seen at home. They don't want to tell nobody. They don't want nobody to know what's going on at home, and they take all of their angry, loneliness to themselves. Self-destructive behavior. They tend to run away because they don't want to see anymore what's going on. Anger issues because they're angry of what's going on at home. Low self-esteem, like I mentioned before. They tend to have low self-esteem because nobody shows them how to be proud of themselves. Although they see it's people hating each other. Difficulty trusting others because how could they trust someone, or how can they trust mom if mom is letting dad hate her? How can they trust dad if dad, instead of being there for mom when she needs it, he's just there hating her? Relationship problems. How can they trust someone with their problems or with their love if all they have seen is problems at home? Children who witness physical abuse are also more likely to be victims in case of the woman, or perpetrators in case of the men, for physical abuse as an adult. Um, or maybe they tend to be the victims too, because all they have seen is mom being the victim or dad being the perpetrator. It can go both ways. What causes physical abuse? Adults who physically abuse children might have emotional or behavioral problems such as difficulty controlling their anger. It can be hard to control anger, but it's not the best way to do it, like to be hitting people. Family or relationship problems. Maybe they're having problems with the family or with their partner, and all they know what to do is just to physical abuse someone. Experience abuse as a child, like I mentioned before, they tend to be, they were the victim before, or they saw mommy being the victim or daddy being the abuser, so now they're doing the same thing. They're abusing their wife or their partner, and that's all they learned when they were little. So they're doing the same thing now that they're older. It could also be caused by stress too. They could be stressed of what they're doing at work, the environment. Some of the statistics that I found, it's that 1 out of 14 children have been physically abused. Over 6,000 children were identified as needing protection from physical abuse last year. That's a high rate of children needing help, and it's just for last year. And 1 out of 14 have been physically abused. That's a lot. Behavior indicator of abuse. Some children tend to be screaming, shouting, yelling. They don't know how to control their emotions, so all they want to do is just scream, yell, or call for attention just by yelling or screaming. And then exhibit emotional outbursts, curse, hit, scratch the caregiver. Some children tend to do that because that's all they see at home. They see, like I explained before, they see mommy or daddy hitting. So that's all they do. That's all they have learned. So they just wanna be heard by just cursing, hitting, slapping, kicking, scratching, spitting their caregivers. It could even be to mom because they have seen daddy doing that to mom. So they want to do the same thing. They tend to be isolated from others. They tend to want to be on their own. They tend to be isolated. They don't like to play with other children. They they don't want to interact with other children. They just want to be playing by themselves, be doing their own thing, not sharing with others. And if somebody comes and want to play with them, they tend to hit, scratch, like I mentioned in the slide before, kick, spit. They tend to exhibit aggressive, disruptive, or delinquent behavior by being aggressive, by trying to hit, kick, scratch their friends, their classmates, people that are taking care of them. they express self-hate, self-blame, guilt, or shame. They tend to mm, blame themselves for doing stuff. For example, when kids are doing something and they go and ask the caregiver or the mom, am I behaving? Am I doing well? Um, or when they tend to ask if they're guilty of doing something, of throwing toys, of hitting friends, or just telling, no, it wasn't me, or those kind of things. Have attention or learning disorders. They tend not to like to do good at school because they think that they're not good enough, that they cannot do it. Mm-mm. And all they want is attention for themselves. They learn passive aggressive behavior from what they have seen at home or with others. They tend to adopt some behaviors as an abuser. Like I mentioned before, they tend to be aggressive with friends, family, caregivers, all of the persons that are around them. They tend to try to do the same of what they have seen or what they have been through. Some of the reasons why people don't report abuse is because of the shock and fear that they go through. Usually when people find out that someone is being abused, they are too shocked to talk about it, and that's one of the reasons why they don't say anything. Self-doubt. Often they doubt themselves and second guess all of their decisions. Sometimes victims are even convinced that what's happening it's normal or even their fault. Uh, Fear of retaliation. Often people don't report the abuse because they are scared of what family and friends are going to say or what they are going to think about them. This can prevent the victim from healing from the trauma. It can also be a problem when it's a family member or a close friend. They often worry if the family is going to take the other person's side. For example, if it's a close family friend or a family member, they're gonna blame the victim, not the perpetrator. They're gonna say that it was their fault, not the perpetrator's fault. Report child abuse. Every 2 seconds, child is abused. 5 out of every 6 cases of child abuse are unreported. Prevention of physical abuse. First, learn how to resolve conflict in a non-violent way. It is fine to argue, even healthy, as long as it doesn't turn into something violent. Teaching the children that violence is not the solution for solving a problem. They can also solve the problem without yelling or hitting. That's the first thing we need to show our children, to try to solve a problem without yelling or hitting or screaming to the other person or to the other child. Always teach them how to use their words. Some of the treatments for the victims that most of the therapists use are often the therapists use play when dealing with children with traumatic events. Art therapy is a purposeful use of visual and art at material and media intervention, counseling, psychotherapy, and rehab. It is often used with any individual age and with any family and group. Music therapy, it's music that is often used to have a positive effect change in the physical, cognitive, and social function in the individual with health and educational problems. Drama, it's often used to achieve a therapeutic goal and symptom relief, emotional and physical integration, and personal growth. Dance is often used to help the patient with their feelings, cognition, physical functioning, and behavior, because the body is connected to the head and it releases emotions and feelings. Poetry, it is a form of healing and personal growth. Play therapy, it's used with clients to prevent or resolve psychosocial difficulties and achieve optimal growth and development. Sand play, they use a sandbox and miniature characters to enable a client to explore the deeper layer of their sand pictures. Integrative approaches, it is expressive therapy to foster awareness, encourage emotional growth, and enhance relationship with others. How they overcome their traumatic event. They often use play to be able to let the child open up their feelings and also to gain the child's trust. The way that they can give details to the therapist. It's often used of toys and dolls to be able to determine where they were hurt, what way the child thinks. That way the child thinks that they are playing and they don't put much attention on what the therapists are asking. They can also be involved in the forensic interviewer. They use the same methods. And these are my references where I retrieve all of the information from for the PowerPoint.